Over the last few days, Uganda has recorded a steady increase in the number of COVID-19 cases and related deaths. This is largely due to an increase in community infections. Given the spike of cases, the Ministry of Health plans to improve emergency services, especially through increasing the availability of ambulances. However, because government has few ambulances, the ministry has begun training private ambulance service providers to beef up the fleet of available emergency vehicles. The team of medics from different parts of the country have been trained on different aspects of emergency care and community outreach. According to the Ministry of Health, many of the people testing positive usually visit private health facilities when they present with the symptoms.
But some of these patients are going in the private sector and they find them unprepared. They may not put on PPEs. They may not quickly suspect a patient.
The commissioner also says as cases of community transmission increase, private health workers are more at risk.
That's why on the pre-hospital side, we are training these ambulance teams so that they can, first of all, protect themselves. Secondly, make sure that they care for these patients well.
Just in case we are called upon, we should be ready and we should have the skills and all the prevention measures.
Some of them didn't even know much information about how they could handle such an incident if it happened.
The ministry also says unlike the ambulances donated by politicians with only nurse and a driver, ambulances recommended for COVID should be equipped with oxygen and masks, among other items.
Have the negative pressure type, which are for these highly infectious diseases like COVID-19. When someone is critically ill, he will require a negative pressure ambulance.
Of our COVID transfers, and that has simple equipment like oxygen and a stretcher and an IV fluid.
The ministry wants to increase the number of emergency vehicles available for deployment, especially in hotspots like Kampala.
The Kampala metropolitan area is an emerging hotspot, and given the high population, the socio-economic lifestyle of the Kampala people, it means that we expect high number of cases rising as this period goes by.
So these people need to be pulled out of the community so that they don't spread the virus to other people.
Each regional referral hospital handling over 10 districts will have 20 ambulances. The Ministry of Health currently has 230 ambulances and wants to double the number to 460. As COVID-19 cases increase with community transmission amidst fatalities, the Ministry of Health hopes that emergency response can be the only way to cap down the spread. As more 230 ambulances are needed, the Ministry also believes that these can be acquired through donors and partners. Kamana Ivan Walnyolo, NTV, Weekend Edition.